gland. So thyroid gland is composed of two lobes. You could see two lobes. So this is one lobe, this is one lobe. Okay, but this diagram is meant for parathyroid. I think, yeah, this is the thyroid gland, right? So what is this structure that you see here? Trachea. So you see the thyroid two lobes, right? Surrounding the vocal cord or trachea, there is a respiratory tract. So thyroid gland are composed of two lobes which are located on either side of trachea. So in the anatomy, so all those things are important, and both the lobes are interconnected with a thin flap of connective tissue called as isthmus. Okay, see, both the lobes are connected by a thin flap of connective tissue called as isthmus, right? Listen, the thyroid gland is composed of follicle and stromal tissue. We are not concerned about the stromal tissue here, but you have to know that thyroid gland is composed of both follicle and stromal tissue, right? So what is follicle? I can say this is a follicle. Say this is a follicle. Okay. Now you will be able to see two different cells here. One I will mark it as blue. Other one I will mark it in red. Okay, something orange. Right. So this is a follicle. So follicle is surrounded by or lined by blue. What is that blue? It is called as a follicular cell. What is called as? It is called as a follicular cell, right? We have assumed blue is the follicular cell. So in between you have another cell, that is what is called as a parafollicular cell, right? That is what is called as a parafollicular cell. Listen, this follicular cell is which produces the hormone thyroid. Whatever hormone we T3, T4, T3, T4 lang ketirikya. So whatever the hormone T3, tetraiodothyronin. Iodine is important for this hormone, right? Or thyroxine, okay, and triiodothyronin or T3. So whatever so called the thyroid hormone that we discussed, everything is produced by the follicular cell. Then what is the other cell which is between the follicular cell? Parafollicular cell. Para means adjacent. Parafollicular cell. And parafollicular cells, okay, they produces another hormone of thyroid gland which is called as calcitonin. So thyroid hormone not only produces thyroid hormone, but it also produces one more hormone called as calcitonin, which regulates which metabolism? Calcium metabolism, Ca2 plus metabolism. Clear arka? Okay, and you have got a space in center, right? And this space is called as follicular space. Okay, this space is what is called as a follicular space, and this follicular space is where the hormone is stored. So thyroid hormone is produced by the follicular cell and stored in the follicular space. So the entire structure is what is called as a follicle, and follicle are usually glued with some tissues called as stromal tissue. Clear arka? And these two are the two hormone, tetraiodothyronin or thyroxine and triiodothyronin. We call it as T3, T4. Have you ever seen the report of a thyroid? You could easily see that. And as the name iodo is mentioned, you can see iodine is essential for the normal rate of hormones in thyroid. That's in case if a person is going to fall deficiency of iodine, right, then hypothyroidism will result, because if there is no proper iodine, then what happens? Less amount of thyroid. So iodine is the part of thyroid hormone. Brick is the part of the building. If there is no brick, then we don't see building, right? Likewise, if there is no iodine, we don't see thyroid hormone. So that results in hypo. Hypo means less, hyper means more. So we call this as a hypothyroidism. And you also see an enlargement of, in absence of iodine, you also see an enlargement of thyroid gland, commonly called as goiter. So all these things happens in absence of, absence of thyroid. So, and they have mentioned, say thyroid is a very important hormone. Hypothyroidism during pregnancy causes defect development and maturation of the growing of baby, leading to stunted growth called as cretinism. See, thyroid hormone will take care of three aspects: physical growth, mental growth, reproductive ability. Growth hormone will generally take care of only physical growth in general. See, there might be some inner depth concepts, but in general thyroid takes care of physical, mental and reproductive. in case if there is going to be a deficiency of thyroid hormone, especially during the initial stages of a baby's development, the baby will be physically retarded, mentally retarded, and reproductive retardation will also be there. That is what is called as a cretinism. You also have one more hormone called as growth hormone, which is produced by, have you heard growth hormone, which is produced by pituitary, okay, which produces hormone, okay, growth hormone, which is also responsible for growth, but majority it is only physical growth. Appo person who is in deficiency of growth hormone will be referred as dwarf, dwarfism, gigantism. So dwarf will be only physically retarded, but not mentally and reproductive. Whereas a cretinism is both physically, mentally, as well as there is going to be a reproductive retardation. சொல்றது புரியுதா, கிளியரா இருக்கா? ஓகே, கொடுத்துருக்க பாரு, mental retardation, low intelligence quotient, abnormal skills, all these symptoms of hypothyroidism, cretinism should be noted. That's the reason if a woman is pregnant, among the important tests that a doctor advises to take, one test is thyroid. Check your thyroid level. So if there is going to be a deficiency of thyroid, then they substitute with the artificial hormone like thyronome or something, where people have to take and ensure that their normal level is maintained. Clear arka? Very cretinism is very important. Okay, in adult woman, hypothyroidism may cause menstrual cycle to become irregular. This is very important, right? Due to cancer of thyroid gland and due to development of nodules of thyroid gland, the rate of synthesis and secretion of thyroid hormones is increased to abnormal high level, leading to a condition called as hyperthyroidism. So they have given two different reasons for hyperthyroidism. One another, what is that? Hey, hyperthyroidism they have given hyperthyroidism due to cancer of thyroid gland or due to development of nodule of the thyroid gland, the rate of synthesis and secretion of thyroid hormone is increased to abnormal high levels, leading to a condition called as hyperthyroidism. Neatla vanda question idu, what are the causes of hyperthyroidism? Rendhiyum podnom, puriyudha? So hypothyroidism ku iodine deficiency, goiter adhalam potukonu, right? And you also see an ophthalmic na, what is ophthalmic? Eye. Ophthalmology, what is ophthalmology? Eye. Pediatric medicine mari ophthalmology na eye. So exophthalmic goiter is a form of hyperthyroidism characterized by enlargement of thyroid gland and say velila. So protrusion of eyeball. Protrusion of eyeball, increased basal metabolic, because thyroid, another important thing, thyroid, one of the important function of thyroid is maintaining BMR, basal metabolic rate. What is basal metabolic rate? You might have some sophisticated definitions for basal metabolic rate, but one important definition is it is the energy required by the body during its physical and mental rest, that is during sleep. When you are physically rest, you are mentally rest, what is the energy that you need to maintain your body? See, you have your dinner by 9 p.m. Immediately you sleep, morning you wake up, you feel hungry na? So you haven't done any work, you have just slept, but you have some basic body energy requirement like heart pumping, kidney function. So during physical and mental rest, what is the energy required by the body? That is what is called as a basal metabolic rate, and that BMR is actually maintained by which one? Thyroid. Thyroid, right? So obviously hypothyroidism will lead to a lower BMR, hypothyroidism will lead to a higher BMR. Okay, and weight loss, which is also called as a Graves' disease, quite serious, right? Grave na serious, right? And thyroid hormone also play an important role in basal metabolic rate. These hormone also supports the process of red blood cell. Everything is important. Each and every sentence could be a possible MCQ. The RBC, red blood cell formation, okay, metabolism of carbohydrate, protein and fats, maintenance of water electrolyte balance, and also influenced by thyroid hormone. They also secrete a protein hormone called as now first parafollicular cells produces calcitonin. So that thyrocalcitonin is also produced that regulates the blood calcium level. Clear arka? Purida? Okay.